Clinic owners, stop guessing. Here's the real reason why your content isn't working, and I'm going to show you how you can fix it in just one afternoon. My name is Jaden, and over the last 5 years, I've generated over $1 million in terms of patient revenue. And today's video, I'm going to show you a really quick way that you can come up with content ideas that actually resonate with your customers. And I'm going to show you how you can do this very easily. This is how we do it over at our agency. I'm going to show you how you can do the same. I call this method the empathy scrolling method. It's exactly how it sounds. This is a 3-step process, very simple to implement. It's basically you going over to social media platforms and search for patients' real experiences, whether they are good or bad. And what you want to do is you want to collate all of these experiences, then come up with a list of content, or at least the things that you should be talking about within your content that speaks and resonates to what your patient actually wants, because these are all real life patient experiences. So let's get started. I'm going to show you over at my screen how you can do this. Step number 1, you have to go to a social media platform. So the platforms that I like to use are TikTok and YouTube. This video, I'm going to show you how to do this on TikTok, but the idea around it is the same. So the first step you want to do is you want to open up obviously the social media platform of your choice, and then think about some of the keywords that a patient or a creator may be titling their videos when they're uploading. So you can think about something like, vlog, or like first time experience, or your service plus experience. And so here's an example for a physiotherapy. So if you're a physiotherapy clinic, you can search for something like first time physiotherapy. And what you want to do is you want to generally avoid content that is posted by either a physiotherapy clinic or a physiotherapist. The reason why is because we are looking for real patient experiences. With this kind of content created by physiotherapists or physiotherapy clinic, generally their intention is to market their own brand, their intention is to market their own clinics. So their experiences may be skewed towards that, but what we really want to find out is real experiences by real patients, right? So I like to look for content that is created by people that doesn't have any kind of affiliation with, either a service or a brand. So for example, I've looked through some of these already, but you can see, this is Align Health. So this is like by a brand. This is also kind of like affiliate content where an influencer is trying to promote another brand. So I'm scrolling through like this. This looks like a genuine, real experience by somebody. So I've already opened this up here. And then you just basically scroll through and look at some of the setups here are pretty obvious that it's done by physiotherapists or a physiotherapy clinic. And then this, like sometimes just looking at the title, you can kind of gauge whether this is like a real experiences or not, right? So off to my first visual session, this looks like a genuine experience. So you just want to open some of these up, and what you are looking for is you're looking for not only good experiences, but you're also looking for bad experiences. Right, so you can key in something like first time physiotherapy. You can try like there are some suggestions here, right? My first time on a therapy be like, but this is more skewed towards like therapy. So if you run a therapy clinic, then these are some great ideas that you can go with. I have some examples open up for dentists as well as dental clinic. So once you have all of this open up, you're essentially done with step number 1. Step number 2, what you want to do now is you want to look through all these videos and you want to pick out certain pain points or certain experiences that they are going through, whether if it's good or bad, and you want to just jot them down, right? Jot them down in a note. So I'm not going to look through all of this. I'm just going to look at some of this together with you guys. This is the one that we picked out earlier, so let's just listen to this and see what we can pick up from this experience.
Sorry, I'm going to be mentioning that all week. Let's go. Yo, shout out Dave. He's got the same name as me and he's been in the game for 25 years. He was even at the London Olympics doing physio there. He's an OG. I'm in good hands. Today, we did a soft tissue release therapy. We didn't do a sports massage because that would just be too intense, he said. I actually agree with him because I was so tight. My quads were finished. He was even nice enough to give me a book to take home and read, which is actually really good because I'm on my phone way too much. If you saw my screen time, you would cry. And he also advised that I take a lot of electrolytes whilst I'm trying to recover, and he advised that I take magnesium as well. Catch you later.
Alright, so it's a really short video, and even with short videos like this, you want to pick out, what are the things that the patients are actually saying that gives them the experience that, this was a good experience, right? So some of the things I picked out are like personal advice and personal recommendations. Did not do a sports massage therapy because it'd be too intense. this is what the patient actually wants, because it's a personal recommendation towards the patient itself, right? So you can see like, you know, these are small little things that you can pick out.
So I'm trying to recover, and he advised I take magnesium as well. Name is me, and he's been in the game for 25 years. He was even at the London Olympics doing physio there.
Alright, so you can see he mentioned that his physiotherapist has over like 25 years of experience. Was even in the Olympics. So yeah, just by this short video, I can pick up like some of the things here. I'm gonna look through a bad experience one so that we can go through this together. So this is a dental example. So let's listen to this together.
I got a filling and I stayed right there, okay? And then lately, you guys, okay, so I've always had weird sensitivity with this tooth. I've been to the endodontist, I've been to the dentist, I have had everybody look at it and they just said it's just a sensitive tooth. It's fine, okay? Now, I don't have pain when I'm brushing, okay? But I will say like, it's like almost like a pressure or just like an ache, like something in my jaw. I don't know if it's because of that too. I'm purposely not eating on that side because I'm afraid that it's going to hurt or trigger something or push bacteria in there, you guys. And listen, if you've been around me, you know I used to go to the dentist religiously, every 6 months. I would even go like every 2 months if I felt the slightest bit of inconvenience or something abnormal. I stopped going. I've been to the dentist in 2 years, you guys. Listen, this one right here, that's obviously got a receding gum line. When I was getting my last cleaning, they scraped it with that little hook thing, struck a nerve through my whole body. Whole body. I thought I died.
Alright, so you can see like from this experience, it was a very traumatic experience for this patient. And so, you know, there are two things that I picked out. So firstly, it's this sense of, you know, whether the patient is left wondering what was the issue with her tooth, because she mentioned like in the earlier part of the video, she'd been to the dentist but they weren't quite sure why her tooth was aching, and then she was left wondering like, is it her issue with her tooth, and then she didn't want to, you know, chew and bite on one side just because she didn't want any pain. So this kind of experience of like, you know, the patient is left wondering whether, you know, has this issue been solved or not, right? So that's first. And the second one is obviously within the surgery or procedure, okay, there was a lack of care that actually caused hurt and trauma for the patient. Alright, so I'm gonna continue listening to it for a little bit longer.
If that's, you have nerves in every single one of your teeth.
Alright, again, you're just gonna jot all of this information down, right? So affected a nerve in her gums, I think. Yeah.
And it hurts so bad when those nerves are messed with. So when they did that, I was like traumatized, like PTSD. Like I am so scared of the dentist now. Mainly because like when I said like, ow, that hurt really bad, the hygienist just looked at me like I was fucking lying. She's like, that's all she did. Just like that.
Alright, so this is also one important point which I also want to take note. Patient does not feel acknowledged, heard, or more importantly, cared for. Right, so I'm going to continue here.
And I was just like, are you guys gonna do anything about that? And they're like, well, you probably just have an exposed nerve. That was it. Never went back to the dentist. Never went back to that dentist for sure. I left them a bad review. I literally erased my good review that I left for them and replaced it with a bad one after that one. Because I do leave good reviews. So I'm scared to go to the dentist. But I know with your teeth, you don't want to hold things off.
Alright, so this is also another good point just from this one video, right? So scared to go to the dentist, but knows she has to go, right? So
if it is bad, you want to get it looked at, because if it gets worse, it's going to be 10 times harder to repair. I don't want a root canal. I'm terrified of root canals. I'd rather just like get this bit pulled, pull it, because root canals aren't forever. And once you get a root canal, eventually it's gonna have to get pulled anyway. So why skip step one and go straight to the final? So yeah, I don't know what's gonna happen. All right, there's no sensitivity. Granted, I'm not eating on that side because I'm terrified, but when I brush with Sensodyne, no problems. If something's not right on this side of my mouth.
Alright, so this alone is a great video, right? Because now you have a list of things like, imagine now if you're creating content, right? So who is your ideal customers? These are your ideal customers, right? Where this patient is telling you, she's left wondering what's the issue with her tooth. So as a dentist, there's so much different types of content that you can do, that you can create, that go after like these specific pain points, right? So this is step number 2, right? So once you have collected all of the things that is positive and negatives, you essentially have a patient or a persona that you can speak to, right? Which brings us to the third step, which is creating the content. When you're coming up with content, this is literally the content topics that you can talk about, right? So for example, there's some topics that you can talk about, like if you are a physiotherapist, what you can do is you can create topic or content around personal recommendations, right? So for example, right, if, obviously I'm not a physiotherapist, but looking at this, you can see like the experience of the patient, that he mentions that recommendations were given to him based off on what he was feeling at a point in time. The topics that you can create is personal recommendations or personal physio recommendations for, let's say, sore muscles, right? Or personal physio recommendations when you have ankle problems. And then the next one that you can create is, experienced physiotherapist. He mentioned that his physiotherapist was somebody who was experienced, have 25 years of experience, and was even in the Olympics. So what you can do on your content is you can create about your own credentials, about your own experiences, and you can create a video like this also. But I really like the dental clinic example here, because as a dentist, now what are some of the videos that you can create? You can create a video that is specifically just talking about, there's so many things here. You can create a video that's just talking about, how you can leave patients without wondering what could be the problem, right? So you can have like what are the procedure, what to do if you feel like you have a tooth problem. Okay, so this is like, for example, what do you do if you feel like you have a tooth problem, right? Because you can see here, patients left wondering what was the issue with a tooth. And then what questions you can ask if you feel like the dentist didn't give you an answer. So like, there are so many types of content you can create. So for example, within the surgery procedure, there was a lack of care caused hurt and trauma. So then what you can do is you can create a content that reassures patients that they will be taken care of, they will be looked after during the procedure, right? So what happens during the procedure? Okay, so for example, this can be a filling procedure, all right? And you want to specifically mention what happens during your filling procedure, not just any other filling procedure, but the experience that your clinic is going to provide them. And then affected a nerve in her gums, patient does not feel acknowledged. So how do we make patients feel cared for? And then you can see here, scared to go to the dentist, but no, she has to go. What to do when you're scared to go to the dentist, right? So here's what to do, right? And then here's what your, like for example, XXX dental clinics promise to patients, right? These are some of the types of content that you can create. And then what you want to do is you want to reassure these patients that have a bad experience that, hey, it's gonna be okay, this is our procedure, this is how we're gonna do things at our clinic. If we're gonna make you feel acknowledged, we're gonna make you feel heard, we're gonna make you feel that you are cared for, right? And this is what we do within the procedure. There's so many types of content now that you can create, right? And essentially these are content that matters to your patients because this is their actual experience of what they went through that caused them to either create something positive on the internet or something negative on the internet, right? So once you have all of this, right, you can jot all of this down and you essentially know what type of content you can create. And To create this type of content, you can just take out your phone and you can just film it directly addressing all these pain points and all these good things, right? So hopefully that should give you a lot of video content ideas that you can work with, that you can create, that is what your patients are actually looking for. And if you like videos like this, please remember to subscribe to the channel because we post videos to help you get more new patients. So I'll see you in the next video.